Good afternoon. Thank you all for being here today. I want to be here to personally tell each of you that what I do today, it matters. Everyone in this room knows that our country is in the middle of the opioid crisis, and I'm so proud of the work that this administration has already done to combat this epidemic. We all know there is still much work to be done, which is why you're all here today. I know one panel will focus on the supply side of this crisis, and the other panel will focus on the prevention, treatment, and recovery. Our unified goal is that of helping all who have been affected by drug addiction, and for me, that means focusing on babies and young mothers, which is something I have been often seen in my travels. I want to read some of a letter I received from a woman named Betsy Henderson, a mother who lost her son to drugs. She wrote this letter to me just 1 month after her son passed away. Ms. Henderson is here with us today. Betty, please join me. Dear Mrs. Trump, on September 22nd, 2017, a needle took the life of my 29-year-old son, Billy. The day after my son's death, I had to go to the medical examiner's office to claim his body. No mother should ever have a body. I'm sure that you as a mother would have some enough to claim their child, understanding of the depths of despair that I experienced on that day. Mrs. Trump, I'm asking for your help in claiming these lost souls before drugs take them from this earth. I pray that we give peace to families in knowing that they told their loved ones how much they are treasured. Patty, thank you for having the strength to reach out in the midst of your grief. Your story touched me, and I know it has now touched everyone in this room. Just as you said in your letter to me, let us all take a moment now and celebrate your son's life. Thank you very much. Thank you. Let's all keep Betty and her son Billy in mind today as you're working through some of the issues related to the opioid epidemic. Sadly, she's not alone in her grief, and we need to change that. Thank you again for your hard work and commitment to this topic. You're all making a real difference, and I look forward to hearing the important action items that everyone will take away from today's summit. Thank you all, God bless you, and God bless the United States of America.
Ladies and gentlemen, Ms. Kellyanne Conway.
As you can see, the First Lady joins her husband, the President of the United States, and the entire administration in their commitment to combating the opioid crisis and the drug demand, drug supply epidemic roiling our country. On October 26, 2017, on this very platform, in this very room, the President and the First Lady delivered a joint policy address about this topic. That same day, the Acting Director of the Health and Human Services, Acting Secretary, he declared a public health emergency And the president deployed and directed his entire administration to do their respective parts in helping to bend the curve on the eye-popping numbers and grief and loss that is roiling this nation. Since then, the administration has made great progress, and the purpose of today's summit is so that we can go to the very top of each cabinet and department and agency represented here today and learn what frontline activities are happening, and also to learn the plan and vision for the future from each of those departments and agencies. I really would like to welcome you again to the White House today, each and every one of you. We have a lot of headliners and decision makers among us, but I really want to recognize with great distinction and gratitude for being here those courageous family members who have suffered loss, and those individuals who currently are either struggling and or are recovering. We see you, we hear you, and we support you. This president and his administration are focused on law enforcement interdiction, treatment and recovery, education and prevention. I believe now we are going to show you some video footage of a project that is in its nascent stages here at the White House, where we call Opioids the Crisis Next Door, meant to represent indeed that no state has been spared and no demographic group has been untouched. We'd like to, I think, dim the lights and show this, and then we'll start our first panel today. Thank you.
I'm Eric Bowling. I'm a television personality and a best-selling author, and I'm here to talk about the opioid crisis and how it affected my family. My son was a very, very social high schooler, grew up in New Jersey, just outside of New York City. He liked to have fun. He was a normal kid, loved baseball, loved his car. He went to the University of Colorado. He had a fantastic freshman year at the University of Colorado. So my wife and I are out to dinner, having a very, very normal dinner. On the way home, my wife was driving and my phone rang. It was about 10:30 at night. My phone rang, cell phone, and it was a young man who was panicked. He said, "Mr. Bowling, call Kayla right now." And I said, "What's going on?" He said, "Just call Kayla right now." She answered her phone and she was crying. I said, "Kayla," for some reason my mind went right to this as a parent. I said, "Kayla, is he alive?" And she said, "No." There was a detective in his apartment. The first week into his sophomore year, Eric Chase died of an opioid overdose. At that moment, my wife, who was in the driver's seat, we had pulled over the side of the road, literally fell into the road. I had to gather her up, and we sat on the curb for about an hour, crying, talking, trying to figure out what just happened. We never saw it coming. We never thought we would get that call. Every parent doesn't want it. We got it. Sorry. Thank you. Thank you. So afterwards, your mind tries to figure out what happened, what went wrong. Is it something we did? And then it's also coupled with, what are the people going to think? What are our neighbors going to think? What are our friends going to think? I mean, it sounds shallow, but that really is some of the things that go through your mind. I didn't know where to go. I had no support system. And so I went to Twitter and I said, look, this happened. I was overwhelmed by the amount and number of people who opioids are affecting. What I have done since then is to talk about the stories of people who are worried about a loved one, worried about a child, a brother, a sister, a mother, a coworker, a friend. It helps to talk about it, and it helps to find resources for that help. There's one underlying issue that I think parents need to understand, and is very, very important. I've seen it over the last few months since Eric's passed. Not my kid syndrome. Not my kid syndrome is terrible. Not my kid syndrome is a killer, because you just don't know. It could very well be your kid. So do us all a favor. Do yourself a favor. Do your family a favor. Do your children a favor. Have the discussion with them, and do it again and again, and get involved in your kids' lives. Find out who they're talking to, who they're hanging around with. Keep an eye on what they're spending and where they're spending it. It matters. You can save someone.
The crisis is terrible, heartbreaking, It's probably the worst thing I've seen. I never thought as fire chief that I would be spending so much time on this opiate crisis. But I think in many ways this is kind of a natural thing for the fire departments out there, that because we're a place that you come to for help. January of 2015, we went from maybe 20 overdoses a month to 75 overdoses a month. And that occurred with the influx of synthetic opiates. Last year, we went to 884 overdoses in the city of Manchester. That doesn't include the overdoses for methamphetamines. Those are just opiates. In May of 2016, we started a program called Safe Stations. The first day I was promoted to chief, I opened up all my fire stations to anybody seeking treatment or seeking help for substance abuse disorder. If it's at 2 o'clock in the morning, if it's during the day, we're always there. We're in all the neighborhoods, and we welcome people in. We treat these, people who are addicted with just very non-judgmental. We'll help you. We'll get you into treatment. If you want treatment, we'll give you a shot at treatment 100% of the time. No one agency can do this themselves. My Safe Station program in the city of Manchester is just a small piece of this. We've seen a 30% reduction in our overdose death rate last year alone. So we went from 90 overdoses to about 64 overdoses. So we know we're saving lives. We're saving lives every single day we go out there.
I'm a physician. I have a master's degree in public health. I'm the United States Surgeon General, and my family is suffering from substance use disorder. My brother Philip is in prison due to crimes he committed to support his addiction. His illness has affected my entire family, emotionally, medically, and financially. As a trauma anesthesiologist, I've seen things that would make the average person cringe, but nothing has shaken me quite like seeing the barbed wire and the thick metal bars when I first visited my little brother in state prison. It was all the more agonizing because despite my knowledge and my experience, I couldn't prevent or fix his illness. I'm hopeful that by sharing my story, it will help people understand that addiction touches every community and that they are not alone. That's why I'm asking everyone to partner with me in this fight for a healthier country. Because for me, and for all too many Americans, stopping the opioid epidemic is not only pressing, it's personal. I encourage you to share your story along with mine so that we can break the stigma.
I've seen one or two. Ladies and gentlemen, our first panel is on prevention, treatment, and recovery. It's my great pleasure and privilege to welcome to the stage Secretary Azar, Secretary Carson, Secretary Shulkin. Secretary Azar, if you would begin with your opening comments. Thank you.
Kellyanne, great. Thanks to the First Lady for those important and personal remarks to kick this off. And Kellyanne, thank you for that wonderful video with those personal stories. I think it's so important to have that message out there of not my kid, because this can impact and hit just anybody. I want to thank President Trump also for making the opioid crisis such a priority. I can assure you that in my discussions with him, it's a constant point of focus for him of ensuring that we're taking bold enough action and devoting enough resources to the challenges ahead. It's a pleasure to be joined here by Secretary Shulkin and Secretary Carson also, as we really work together as an administration to tackle this crisis. I want to start off with an important statement. At HHS and across this administration, we know that we need to treat addiction as a medical challenge, not as a moral failing. That informs HHS's work across all three areas that we're here to talk about today: prevention, treatment, and recovery. And it's why the President has directed HHS to consider the declaration of the public health emergency last fall, and why we declared such an emergency on October 26, 2017. This emergency declaration has brought a new level of focus and coordination and cooperation to our work across the federal government as an entirety. And so I want to give you just some examples of what has happened and what we've accomplished since then. First, we know it's essential to prevent people from getting addicted to opioids in the first place. We've seen promising news on appropriate opioid prescribing. Prescribing is down noticeably from 2010 to 2015, but it's still 3 times what it was in 1999. Just one example of our work on this front. In December, as part of a broader reform initiative to use data better across HHS, we held an opioids codathon. I had to learn that word, codathon, where we brought in top data scientists from schools like Yale, Stanford, and Hopkins, and top tech companies. And what they did is the programmers spent the day coming up with new tools for prevention, like apps that use existing data sets to monitor risky opioid prescribing and help providers assess their own prescribing levels to see if they were out of the norm and needed focus on their own habits. We also know treatment, including evidence-based methods like medication-assisted treatment, is essential to this fight. Shortly after the public health emergency declaration, we announced a streamlined process for states to get waivers that could support substance abuse treatment, and we've approved 5 of these waivers so far. This weekend at the National Governors Association, I actually berated the governors saying, why have I only gotten 5 of these so far? I told them we're eager to work with them. We have a streamlined process for considering them, and I want more. At the NGA, we also highlighted 2 forthcoming Food and Drug Administration guidances that will expand and accelerate medication-assisted treatment. One of them will help the development of long-acting depot formulations like the monthly shot that was approved this past fall, and one that will open up new ways of assessing medically assisted treatment effectiveness by looking at metrics besides just achieving abstinence, complete abstinence, so alternative endpoints. On recovery, this year and last, we're issuing $500 million per year in targeted response grants to state governments, which cover prevention and treatment, but also recovery supports. These supports are a key piece of successful treatment, including medically assisted treatment. To support that grant program, we announced a new method of technical assistance in November to use more local experts and expertise to provide technical assistance to states and grantees rather than a traditional one-size-fits-all approach from Washington. The goal is also to emphasize truly effective evidence-based policies. The President's budget also proposes doubling these state grants to $1 billion a year as part of a historic $13 billion package in proposed funding for this crisis. That's just a small sample of the work that we're doing, and all of it requires the contributions and cooperation of our partners on the front lines, which includes many of you here in this room. That's why the President's holding this event today, so we can share our work with you, and so we can solicit your input on what we need to do further. So thank you for joining us here today. And we and all of our partners across the federal government look forward to working with you as we tackle the scourge of this opioid crisis. Thank you.
Secretary Carson, thank you. Secretary Azar, thank you so much for those remarks.
Well, first of all, thank you, Kellyanne, for leading out in this endeavor. Grateful for the leadership of the President and the First Lady and my fellow cabinet secretaries as well as the Surgeon General for bringing this to the level of attention that it should have. It is affecting virtually every part of our society and the very fabric of our society. And I'm also grateful to all of you who've come here to show your interest and support for what's going on. Everybody has a sphere of influence. And together, we can really take this important issue to where it needs to be. At the Department of Housing and Urban Development, the human cost of opioids is all too familiar to all of us. For us, drug addiction lands at an intersection of health, housing, and economic opportunity. It is especially dangerous to the communities that HUD serves. So we're being especially vigilant in our efforts to address this epidemic and all of its consequences. In fiscal year 2017, 76,000, or approximately 25% of those served at HUD-funded continuum of care, reported substance abuse issues. That's a lot of folks. Moving forward, we have convened senior leadership from all program offices, working collaboratively to recommend near-term actions to impact both awareness and treatment. We've also convened all program offices to think through the strategic changes to rules and guidance that will support the efforts of law enforcement to tackle drug traffickers and drug use prevention and treatment for those struggling with addiction. We are continuing to study local success stories across the country, identifying good models and data to be integrated into HUD's notices of funding availability that have proven to be effective and are promising in addressing substance abuse. And that is really a key factor when it comes to making progress. When you look at the turn of the century before this past one, the average age of death in America was under 50. And at the most recent turn of the century, we're approaching 80. How did that happen? It was because the medical profession began to make its policies and its recommendations based on evidence. And it makes all the difference in the world. These conversations with public officials, private foundations from San Diego to New York are ongoing. Our new Envision Center initiative will have community health and wellness as one of its core missions. The Envision Centers will work to improve access to health services, including drug treatment and prevention for those struggling with drug addiction, including opioids. But it is important to note that the scourge of opioids in America is not simply a crisis of health. It's also a crisis of hope. The Envision Centers will also leverage public-private partnerships to promote long-term economic, educational, and employment opportunities in our communities, all things which bring hope. Once more, Americans will have the tools to build a brighter future, and fewer of them will try to escape their current realities through drugs. This is a challenge that will take our combined resources and ingenuity to solve. But together, we can solve it and save thousands of lives in the process. I look forward to further collaborations with my fellow agency heads and all of you in the coming year.
Secretary and Dr. Carson, thank you. Secretary and Dr. Shulkin, you're on.
Thank you very much. You know, as I look around the audience, there's just such amazing expertise and personal experience with this issue. And whenever I go to an event, I always have a goal of taking away a message or meeting somebody that's going to help me. So thank you all so much for being here. And I hope that you too will meet people in this room, learn something and take away something to help contribute. I really want to also thank the President and the First Lady for giving us all this opportunity to be here. And I have 3 points I wanted to share with you in the hope that you'll take something away as well. The first is that I do believe, I'm optimistic, that we can make a difference, that we can really help save lives. At the Department of Veteran Affairs, as you know, we're the largest health system in the country. We began to see this problem in opioid addiction and crisis before maybe other health systems. We started focusing on this in 2011. And in 2012, we launched the Opioid Safety Initiative that has put in over $300 million into prevention and treatment. Since 2012, we've reduced the number of opioids used in the VA by 41%. And the way, if you take a look at that figure of a 41% reduction, it's come through a 90% reduction in the start of new opioids. So by looking at alternatives, instead of just reaching for the prescription pad, as probably Dr. Carson and I learned when we were in medical school, we've had a 90% reduction. So there is hope out there, and we can do better and save lives. Second point is that as we begin to share best practices, we have a lot to learn from each other. Kellyanne, and thanks to her leadership, and Governor Christie, who helped lead our commission that I had a chance to participate in, we went around the country and visited places that were really doing this well. The Department of Veteran Affairs took an unusual step about 2 months ago, and we now publish publicly all of our opioid prescribing rates for every VA medical center across the country. Now, we're the only health system in the country that does this. There is nobody else doing it, but we did it to try to encourage others to follow the lead. If you take a look at data.va.gov, you'll see all of our prescribing rates. You'll see the highest in the country is in Roseburg, Oregon, at 20% of all prescriptions, to the lowest in the country in Cleveland at 3%, where Kellyanne and I went to visit. So by sharing these practices, we know that we can help each other learn, and I encourage the rest of the country to help participate, and the VA is there to help teach. The third and final point, I just wanted to share the way that we've gotten this 41% reduction and this 90% reduction in new opioids. At VA, I quickly learned if you have something important, you better develop an acronym, because there is no initiative at VA that doesn't have an acronym. So I actually made this one up. It's called Stop Pain, okay? So the S in Stop Pain is for a stepped care model. Instead of reaching for opioids initially, we have a stepped approach towards pain management where opioids is at the end, not at the beginning. The T is for treatment alternatives, and we've really focused on integrative medicine and non-medicinal aspects, as well as Secretary Azar talked about, the medication-approved treatments that offer alternatives when people are addicted. The O in STOP, the O is for ongoing monitoring and usage. So we actually use data to identify where there are problems, where there are bumps in high usage rates, so that we can go and effectively intervene. The P is for practice guidelines. I'm proud that the Department of Defense, the Department of Veteran Affairs, the CDC have all jointly published pain management practice guidelines available in the public domain that we teach our clinicians. The P for pain is for prescription monitoring. We participate in the state data prescription monitoring programs, which are really important in the state, so that we as doctors, I'm still a practicing internist, I go to these state practitioner databases to see if other doctors have prescribed medication. The A for pain, the A is for academic detailing. We send our pharmacists out to train our doctors into how to appropriately prescribe opioids. The I is for informed consent. We have our patients sign informed consents before they use opioids, because they have a shared responsibility in this. And the N is for naloxone distribution. At the Department of Veteran Affairs, we've distributed over 100,000 naloxone kits to our first responders and to veterans themselves, and we know that that saves lives. So I hope maybe you'll pick up one of those and continue to share your experience, and together I know we can make a difference. Thank you very much.
Thank you very much, Secretary Shulkin. Now we'll take some questions from the audience. The first question comes from Carla Strunk from Richmond, Kentucky. Hi, Carla.
As you said, my name is Carla Strunk. I am from Richmond, Kentucky, and I would like to just say that I'm here because I lost my only son to the opioid epidemic. I would like to share this as his picture, and I did that because I made a promise to him that when I lost him, that I would fight. So I'm here today not only for myself, but for everyone that's lost their child or their loved one to the epidemic. My question for the panel is that since this has happened with my son, I've had the opportunity to go out in my community, be part of the U.S. Attorney's HEAT program, and go into the schools, because my son's addiction, like most, started at a very young age. So my question is Is there a plan to put something like a prevention program into the schools nationwide? I've seen the effect that being able to go in and talk to these young kids who don't understand that your first time using probably could be your last time. It's very effective. Thank you.
What, first of all, what was your son's name? Brendan. Well, I mean, thank you for sharing that story. Does anybody have any particular thoughts about schools? Okay.
Thank you very much for being here, Carla, and I'm with everyone in telling you how sorry we are for your loss and how moved we are by your courage to channel your grief into something positive for other families and other students. The First Lady and the President and Secretary DeVos and other stakeholders and decision makers are very invested in making sure that we communicate a message of prevention and education, particularly to our youth, and that the First Lady is very committed to the well-being of children overall, and this would be a part of that. We, I think, to begin just by educating each other, not just on the harrowing statistics, but on the basics. I would imagine most of America suffers from information underload when it comes to fentanyl, for example, which took the lives of 20,000 Americans last year. And if 20,000 Americans were dying every single year from almost anything, we would stop and turn our attention to that immediately. So I think what the President and others are urging is let's stop and at least turn part of our attention to that. So getting into the schools, making this part of the curriculum is a goal. I've had occasion with my colleagues inside the White House and across the administration to learn all the great work that's being done in the private sector and the nonprofit community. And I'd invite others to come forward and tell us what they're working on so we can see their best practices. But there are a lot of folks out there who have developed great ways of communicating with youth. And it's not just youth. If we can tell people the way the President told them on October 26th that the last Saturday of every October and every April we have the DEA runs what's called Take Back Day. Why not make Take Back Day every day somehow? If we can work with the pharmacies, if we can work with the local first responders, to the extent that it doesn't overtax them, but to the extent that we can tell people you don't have to wait for twice a year. There's a way to safely dispose this. Some of the private sector businesses are working on this as well. But we have to get to youth, whether it's after school, community messaging, and that is a big part. This is why the President is committed to education and prevention. He's also committed to interdiction law enforcement, of course, treatment and recovery. I would also note that the President's Commission on combating the opioid crisis and drug demand had 56 recommendations that they issued. The Commission did great work. The President has accepted all 56 of those recommendations. It's a public document, and this is covered there as well. Our next question comes from Ryan Hampton from Pasadena, California. Ryan? Hi, Ryan. There's a mic coming.
My name is Ryan Hampton. I'm a person in sustained recovery from a substance use disorder, and what that means to me is that I haven't felt it necessary to have a drink or a drug, and most importantly to me, heroin or opioids, since February 2nd, 2015. Thank you. And I know how incredibly lucky I am to have made it out of this crisis alive. But I also know that recovery and access to recovery and recovery supports should never be about luck. And in 2015, when I got out of treatment for the last time, I was able to access stable recovery housing and recovery supports that came with that. And I know that if it weren't for those 18 months of that stable housing, I probably wouldn't be here today. Also, in the last 2 years, I've probably lost way over a dozen friends, people that I care about, people that I love, people in my community, to accidental opioid overdoses. The majority of them were not able to access the full continuum of care that included stable recovery housing. So my question to the panel, the whole panel, would be, since we know that the first 5 years of someone's recovery is most important, how can we support people through that full continuum, specifically when it comes to stable, qualified, and ethical recovery housing and residences? Thank you.
Well, thank you for that question. As I mentioned in my opening, there is a true nexus between opioid abuse, drug abuse, and housing. And that's why it's so incredibly important, and that's why one of the reasons that Housing and Urban Development has coupled with the VA for the HUD-VASH program and various ways of making sure that our veterans actually have a secure place from which to recover. But it spreads, far beyond that. It's all aspects of our society. And we have continuum of care programs. We've devoted a significant amount of money to that very issue of providing the kind of recovery that's necessary. I think it's critical that people understand that people who are addicted to opioids are not like them, and then there's us. I mean, it's all of us. It can be any of us at any time. It is so easy to get addicted. And it has nothing to do with socioeconomic class or anything else. And we need to recognize that in our society right now, it permeates to the extent that probably anybody that you talk to knows somebody or has a family member who has been affected. If you talk to manufacturers, they will tell you that it is very difficult to find people to work who can pass a drug screening. So that gives you some idea of the pervasiveness of this in our society. And that's the reason that we have an interagency cooperation working with HHS, all of us recognizing what an incredible scourge on our society this is and how it impacts virtually every portion of us. But as you have very correctly stated, we do understand that providing the kind of place where they feel secure and stable is the first step. And when you're talking about recovering from opioids, you're not talking about a few weeks. You're generally talking about 18 months. So it's a long-term commitment. And as a society, we have to recognize that until it becomes as easy to get treatment as it is to get the drugs, we're not going to win the battle.
And the issue you raised, Ryan, about that kind of support in the recovery period, that's why the president's doubled the amount of state treatment and response funding grant programs from $500 million to $1 billion. We already put out more money to states and localities last year than ever before in history, and now that's going to more than double, doubling in just that type of grant to $1 billion that can be used to help with these kinds of programs. And then we're putting out $75 million of naloxone funding so that the first responders can have access to adequate supplies of naloxone at a good cost. We're also working to create a $150 million grant program for rural treatment so that not just in Pasadena, but also in more remote and rural parts of our country where folks really are in underserved areas from a treatment perspective, that we can provide more support there. Another almost $500 million for community health centers, which provide such a vital safety net for folks for treatment, response, and ongoing recovery. So it is, I'd say, even beyond the 18 months, as I mentioned in my opening, I think of it as a lifelong process for folks.
Thank you very much, and thank you, Ryan. The First Lady of North Dakota is Catherine Burgum. She's been an inspiration to many people who have heard her story, and today she'd like to talk to us about destigmatization and something the President has talked about, breaking through the silence and the stigma. Catherine?
Thanks, Kellyanne. I am so grateful to the administration for bringing together these stakeholders and decision makers for this important conversation about ending the opioid crisis. I've been in long-term recovery for 16 years. Thank you. And I know from personal experience how stigma prevents people from reaching out for help and talking about the disease of addiction. I did not seek real help for almost 20 years because I was ashamed. Stigma puts up walls. It is socially constructed, based in fear, and usually contains inaccurate information. If we can begin to normalize the conversation around the chronic brain disease of addiction and talk about it like we talk about other chronic diseases like diabetes and heart disease, we can end the stigma. We can change cultures from misinterpretation to empathy, cultures in our communities. It's so great the administration has created this website for people to share their addiction and recovery stories, because that's going to go a long way to breaking down the barrier of stigma. In North Dakota, we've launched a multi-year, multimedia communications campaign designed to inform about the disease of addiction and eliminate stigma. We call the campaign our Dream Again campaign. So my question is, has the administration considered a communications campaign that promotes understanding and empathy towards those struggling with the disease of addiction? And just know I stand ready to help this administration in any way I can to eliminate the opioid crisis and the stigma of addiction. Thank you.
So we do anticipate launching a mass and multimedia campaign, not just to educate people about the dangers of addiction, the fact that it can come to anybody, to any family. And as part of that, I do think the destigmatization of substance use disorder is critical. We have to get people willing to seek out treatment. It's one of the reasons part of our program is to support drug courts also, to just allow diversion for people so that it's not about just going, just facing criminal consequences, but can we get people into appropriate substance use treatment programs, which is the help that they often really need. And so our multimedia campaign, I'm glad to get this feedback from you about destigmatization so that as Kellyanne and I and others work on this, we can ensure that those messages are part of the campaign also. Thank you.
The education is absolutely critical, and it's one of the components of the Envision centers that will be populating places throughout the country. Comes from a Bible verse that says, without a vision, the people perish, but we call them Envision centers because we didn't want people to think they were going to get glasses. But but there's a strong educational component. And prevention is a key portion of that educational component also. So coupling with many of the nonprofits and philanthropic organizations that are already in our various communities, bringing them together with the need, putting them in juxtaposition, I think will have a very good impact.
Thank you. Gary Tennis from Harrisburg, Pennsylvania. Gary, welcome.
Thank you so much, and thank you for pulling all of this together. I am president of the National Alliance for Model State Drug Laws. Before that, was secretary for the Pennsylvania Department of Drug and Alcohol Programs, and most of my career was a prosecutor in the Philadelphia District Attorney's Office for 26 years. During those 26 years, I saw a parade of individuals, of criminal defendants going before me with untreated or undertreated addiction. Most of the problems we were trying to solve in the criminal justice system were a consequence of a failed healthcare policy of not providing enough treatment. As you all have said, the resources have never been there. I would say probably this is a multi-pronged problem. There are many aspects to the solution. I've been looking at this problem now for 30 years. The biggest single blow that this administration could deal in terms of ensuring more people get treatment is to make clear that the IMD exclusion, which was meant to stop the warehousing of the mentally ill, is no longer applied in the area of drug and alcohol addiction treatment. It never was meant for that. There was never a problem with warehousing the mentally ill or warehousing people with drug and alcohol. So I would just ask you, I know you're looking at the waiver process, which is time-consuming. It has various idiosyncrasies. Would the president or the administration consider just dealing a single strong, powerful blow by saying the IMD was for mental illness, it does not apply to drug and alcohol addiction treatment?
So Gary, we agree about the IMD exclusion. This is a provision that, as Gary mentioned, was intended decades ago. well-meaning to prevent the warehousing of people with mental illness into these giant state institutions, sort of the stereotypical thing. And it was a provision that said that Medicaid funds cannot be used for facilities that have more than 15 beds. And so what President Trump did is actually create this streamlined waiver process so that states can come in and for substance use disorder, exactly the issues Gary talked about, grant that permission so that we can indeed at the state and federal level reimburse for inpatient treatment for substance use disorder. It is a very streamlined process. In fact, this was the issue that I was raising with the governors this weekend, is oftentimes governors will come in with a whole package of requests around their Medicaid program to do a whole restructuring of Medicaid that presents unbelievably complex financial and statutory and legal issues. And I told them, just separate your waiver requests for the IMD exclusion, and we'll handle those as a separate, streamlined, fast thing. Let's not let them be slowed down by the broader reforms you're trying to do in your Medicaid program. And so, in fact, we did that right here in the Red Room with the governors. And so I'm hopeful that we will see a faster clip. We can handle those quite quickly. Those waivers are very easy to do. It is a statute, and the president's budget has proposed changing the statute. As long as the statute is there, however, I've got to use my waiver authority, but we're open for business on them. I made that very clear to all the governors, and we will process them very quickly.
And Gary, let me just say thank you for sharing your experience. In the Department of Veteran Affairs, I'm sure you're aware, we have veteran courts throughout the country, and they're set up to do exactly what you're talking about, to allow judges to understand that rather than sending people to prison for substance abuse and other mental health issues, get them right into treatment. We do this around the country with thousands of veterans, and we have an 80% reduction in one-year recidivism back to prisons. We're getting people that help. So I think it's exactly your experience, and I know Secretary Azar, through the waiver process and the statute change, is going to allow us to do that for more Americans. So thank you.
Cece Brown, a woman I've come to know and who we rely upon for... Cece, you're here? There you are. Cece, thank you for being here today if you have a question.
Yes, I do. First, I want to tell you the reason I'm here. It's because we lost our son, Ryan, to a heroin overdose. He died in a very public place. He died of a heroin overdose in Macy's bathroom. And at that time, when the detectives came to tell us what had happened, we said we didn't want this to happen to one more person. And that's exactly why we're here. And these two individuals that have had the courage to speak up, that gives me hope, and I hope it does you as well. I'm so grateful for you, what you're doing, the focus on the opiate epidemic. But Ryan was on a wait list for 2 programs when he died. And what he said to me, I was walking down the hall, and I saw him sitting in his bedroom, and he looked at me and he said, "Mom, I'm trying. I'm trying." And of course, he met someone at the mall unexpectedly, and there it happened. He hadn't been using. But that's my concern. We started Ryan's Hope, an organization to raise awareness about addiction and overdose, and also to advocate for recovery. The reason we named it that is I said to Ryan, another day is a day of hope. And if people don't have opportunity is everything. And that's what this whole thing is about for me. It's about people, and it's about saving lives so we don't have any other parents to go through this, so we don't lose another son or a daughter. I get a little passionate. But I think it's so important. So this leads me to my question. Of the $6 billion that is budgeted for the opiate epidemic, can you tell me what is targeted for prevention and treatment? Reason being is that I think we need to get ahead of it. We sent Ryan to college, and that's where it all started. I went to a training session on how to talk to kids about drugs, and guess what? I sat there and just checked each one off. I'd done it. So something was not right. Something was not. So I do think we need to look at things differently with prevention and put a face on it. You know, in the schools or wherever, whether it's in church, actually help with the sound system at church. And had a scholarship. So that's what I wanted to know is what's going to be dedicated to treatment and prevention, because that's just critical for me. Thank you.
Thank you, Mrs. and Mr. Brown.
Well, that's a very important question. I can't give you percentages, but I can tell you a few weeks ago I was in Kentucky, and they have hope centers there for the purpose of treating people who've been addicted. And these are all public-private partnerships. So of the $6 billion through the various agencies, a lot of it is going to be used in conjunction with state and local programs. And that's where the real impetus comes. It's not necessarily from a federal bureaucrat, but it's from the people in the neighborhoods who are right there with boots on the ground. And there's so much compassion in our country, and there's so much philanthropy in our country. So what the government actually provides in these private-public partnerships is probably the minority of funding and the minority of attention. It's going to really come locally, and it's something that really needs to be encouraged.
And Cece, I would say within how the Department of Health and Human Services will spend its portion of the money, essentially all of it is prevention, treatment, response. Some of it longer-term treatment. So for instance, in 2019, we would be dedicating over $750 million of our funding to the National Institutes of Health to develop the next generation non-opioid pain treatments so that we can hopefully stop people from even beginning and getting into the system through legal opioid use for pain, through alternative therapies that are non-opioid for pain treatment, in addition to studying alternative therapies to deal with pain beyond the pill. And so that's something else that NIH is funding. So I'd say longer-term prevention there, the rest much more what you would think of as traditional prevention, treatment, response recovery programs. I spoke this weekend how 1/3 of our treatment facilities in America have medically assisted therapy. That's unacceptable. It's a proven evidence-based approach. There are many approaches to addiction and treatment. We know this one works though, and 1/3 is not enough, and we need to use this funding we're getting to build up more medically assisted treatment facilities.
Thank you very much. We have two more questions. Dr. John Rosa of Darnestown, Maryland.
Are we on? There we go. Thank you. First, I want to thank the President, First Lady, administration, panel, participants. We have a lot of experts and families that have been affected, so thank you very much for being able to put something like this together. My name is Dr. John Rosa. I have 14 integrative medicine clinics in the DMV, which incorporate medicine, chiropractic, physical therapy, acupuncture, yoga therapy, mindfulness, nutrition, supplement treatment for pain. Many of the government agencies and some organizations like the CDC, FDA, the VA, American College of Physicians, Joint Commissions have suggested and/or required physicians to use these alternative treatments as the first line of care in lieu of medication. 90% of the consumption of opioids comes from this country, and we're 5% of the world's population. So the other parts of the world have obviously been using these type of alternative therapies to combat pain before that prescription's written. And that's just to let it sink in. Over 90% of the opioids produced are consumed by the United States of America. And I also treat professional athletes. So if we get an NBA player who gets hurts his back, we have 4 or 5 experts on this guy immediately. There's a chiropractor, there's a therapist, there's an orthopedic surgeon, there's the trainer. He's treated 3 times a day until he's okay to practice. When he practices, we videotape what he's doing so we know that his motion's okay. He gets to be cleared to play ball when he is in pre-injury status. Same guy gets hurt, same exact condition, goes to the medical office, gets an opioid, gets sent home for rest. Where does the breakdown occur? And we know that these research methods of treating people and that are, scientifically proven and used in professional sports, not good enough for the average person. We're creating a society of chronic pain patients because when they go home with that first script and they're not treated right away, the propensity for this to be a reoccurring condition in the future goes higher every time that episode occurs. So going way upstream in prevention is to stop that script from ever getting written. We've touched on it a bit, but part of one of my clinics out of the 14 is a free clinic in Maryland. And in that free clinic, it's in a very busy medical practice, primary care, and within a year's time, we've reduced the script writing by 70% for opioids in that clinic. Now, we had our meeting, and I said, you got to tell me what happened. 70%, 10% you write a paper, 70% you call somebody. Yeah, and the answer was, well, you're here. Can it be that easy that if it's available, you're not going to have that process take place? So my question, with all that emotion, because I obviously head into this, but the question would be, how do we instill the proper referral for and the insurance reimbursement of these known evidence-based alternatives for treatment? And I am at your disposal at any time because I've been doing it for so long. So feel free to call on me when needed.
Well, Doctor, that's exactly the issue I was mentioning to Cece a second ago, which is the investment that we're making at the National Institutes of Health around alternative pain management to build the evidence base to support reimbursement. We also, it's a fair point, we need to look at our reimbursement systems, which were really built in the 1960s around siloed ways of paying for a drug, paying for a device, paying for a procedure, and set in statute in a very concrete way that isn't always as adapted and adaptable to evolutions in non-traditional forms of treatment. So in fairness, we need to look at that, and we need to do so from an evidence base, working with our National Institute of Health and the Food and Drug Administration. So we've got that charge, and that is part of our focus.
Yeah, I think about what you're trying to do with four different approaches, and Secretary Azar just mentioned two of them. You have to have the providers in your network, if you have an insurance plan that has access to them. You have to be able to pay the providers for those types of alternative or integrative therapies. But there's two other things that we've learned in the Department of Veteran Affairs. One is we encourage team-based approaches to care, and I think that's what you're doing in your clinics. Instead of it being a solo provider, we have teams of nurses, doctors, physical therapists, pharmacists, social workers, all of whom then can suggest alternative approaches. And finally, what we're doubling down on in the Department of Veteran Affairs now is teaching the patient, in our case the veteran, self-care, and letting them know how do they take care of themselves and what alternatives should they be thinking about rather than just listening to what a provider says to them so that they're an active participant. So I think when you take those four things, we can see more of what you've been able to experience.
Our last question is from Greg Delaney of Ohio. Hi, Greg.
It is such an honor to be here with you folks. Much like my sister and my brother here, I'm in long-term recovery myself, 10 years in July, so it's wonderful to be with others. I nearly lost my life to addiction, and yet while I was coming through recovery, it was the work of a pastor that really made all the difference for me. And so what I wanted to kind of talk about is that since that time of intervention from him, we've had the wonderful opportunity in Ohio to try to mobilize our church and faith community to being a part of the solution in this particular crisis. And we've had wonderful relationships with our Attorney General, Mike DeWine. We've expanded those in with Attorney General Morrissey in West Virginia. Probably done 60, 65 forums with faith leaders trying to help them find their lane. Many of them have found their lane, but what they have found is that to navigate funding for their lane has been intensely difficult because of their faith-based nature. So my question on behalf of all of them today, and myself as a pastor, who have buried about 12 folks in this challenge, how can we eliminate some of the perceived or real barriers to some of this funding for those that are doing great grassroots work at the faith-based level? Thank you.
Well, glad you brought that up. You know, the faith-based community is one of the real foundations of American values, and have taken on the responsibility of helping those, particularly those who are helpless, or who, as the book of James says, the fatherless and the widows, the people who need our help the most. That certainly includes those who are addicted, which affects their behavior, which frequently puts them in a very vulnerable position. At HUD, we have grown our faith-based component, and I think that's been the case in several other agencies. The President and the White House has made a very significant effort to make sure that we protect the faith-based community and religious freedom, while at the same time respecting everybody's beliefs. That's really the key. So I think you will find this effort that we're putting forth will very nicely encompass the faith-based community.
And please grab me afterwards. We each have faith-based offices. Our job is to remove barriers to faith-based providers of services who may be unfairly discriminated against in the provision of critical care to our people. So at HHS, I'd like to know if we're getting in the way of that, or there are things that we can do to be better. So thank you.
Thank you. Please join me in thanking Secretary Azar, Secretary Carson, Secretary Shulkin. Thank you very much. Thank you so much. Thank you. Ladies and gentlemen, I'd like to call to the stage Jim Carroll. He's the Acting Director of ONDCP, and he'd like to make a few remarks.
Thank you. Thank you, Kellyanne. It's an honor to be here today, and I greatly appreciate the trust the President has placed in me to work with you all on this issue. Since I just started about a week ago, I have not had the opportunity to meet with many of you quite yet, but I'm looking forward to doing that in the coming months and years. This is one of the President's greatest priorities, and it is an honor to be here with you today. In addition to the many families that are here, I also want to recognize that we have about 12 police chiefs from across the country who came to hear this message and to share their stories with us. Like so many of us, law enforcement families are not immune from this epidemic. I wanted to tell you a little bit about myself. Like Dr. Collins, I started my career as a state prosecutor, where I spent the vast majority of my time prosecuting drug cases. But I just didn't spend my time inside a courtroom. I also was out there on the streets with my colleagues, the law enforcement officers out there, to actually understand what they were going through. So I've seen how this tears families apart. I went on to the private sector at a large corporation and was the global director of compliance. And so I became involved and aware of the importance of a strong employee assistance program to help our employees through this, because this becomes an economic issue as well. Here at the White House, as Deputy Chief of Staff, I got the opportunity to work behind the scenes with Kellyanne as the leader in this effort and work with many of my colleagues here on the stage today. Since I started last week, I did have the opportunity to meet with Tony Luke, who runs a chain of cheesesteak restaurants in Philly. Congratulations to the Eagles this year. Tragically, as many of you know, he lost his son as well last year. Yesterday, I met with this beautiful, kind-hearted woman who's raising her granddaughter as her own daughter fights this challenge. So many families have been affected by this. When I met with the First Lady of North Dakota, who was here and shared her story with me, she mentioned that in North Dakota, I think it's 1 out of 7 either has a family member, a friend, or a neighbor who's been impacted by this. For the first time publicly, I want to tell you that I am that 1 in 7, that I have a family member who has been touched by this. And last year I was in the rehab center with my family member, holding that person's hand, helping them through this, and trying to be that support system. And so it's a great honor for me to take this on. This is a professional and a personal challenge for me, for the president, and every member of this administration. The last thing that I want to close with is that sadly, at the Office of National Drug Control Policy, we have a collection of prayer cards from the funerals of so many young people. Pastor, you talked about that, how many funerals you've been to. And so we have a collection of the prayer cards. And one I keep on my desk is for a young man named Archie. And it reads, God of love, graciously ease our burdens from this epidemic, calm our anxieties, and strengthen our faith. I look forward to working with you all on this great epidemic. Thank you, Kellyanne. Thank you, everyone.
Jim Carroll, thank you. Obviously, the president made an excellent choice. We're now going to take a very brief break and bring up our law enforcement interdiction panel in about 5 minutes. Thank you. Welcome back. This is our second panel with the Attorney General, Jeff Sessions, Secretary of Homeland Security, Kirstjen Nielsen, and the Deputy Secretary of State, Mr. Sullivan. The focus of this panel is interdiction and law enforcement, which of course plays a very important role in the overall drug supply and drug demand opioid crisis efforts by the President and this administration. Without further ado, I'd like to recognize Attorney General Sessions to begin. Thank you, sir. You can stand if you like. It's up to you.
Sometimes I like standing. Technology. The media magic. Thank you all. It's so good to be with you, and we're at a point where we are going to make some progress in America. I am convinced. We know that prices for illegal drugs are down, the availability is up, and the purity is up, and the addiction is up, and the death is up, and the danger of the drugs, particularly the fentanyl and heroin combinations we're seeing, are just extraordinary. I was involved in the early 80s as a United States attorney working on these issues, and we never saw anything like the deaths that we're seeing today. This is totally unprecedented in the history of this country. It cannot continue. It will not continue. The President has made it clear we're going to be resolute. The entire administration is going to respond to his declaration of an emergency, and we're going to make a difference. I just tell you, I believe it. I can sense it already in some of the policies that are ongoing out there. We announced in July the largest medical takedown in the history of our country. We had over 120 professionals, nurses and doctors who had been out of 400, I believe, arrestees that were involved in illegal prescription drugs. And we know that as much as 80% of addictions today start with prescription drugs. That's an extraordinary number, and we'll continue to research it, but that's the numbers that we have, and I have no doubt it's an extraordinary high amount starts as prescription drugs. We also had, a week later, the shutdown of Alpha Bay. This is important. It's a dark web site in which had 220,000 sites where people could order directly through the mail illegal drugs. And of course, fentanyl, for example, is so small, so compact, and such a little bit is so powerful that it's easy to ship these kind of drugs through the mail. The FBI has doubled its resources to identify earlier. We're not going to let those sites get that big again in the future. That's certainly our goal, and we're going to continue to work on that. We've indicted some 3,000 defendants for distributing drugs in 2017, and we created the Opioid Fraud, Abuse, and Detection Network, which is a data analytics system that's well within the existing computer systems of the Drug Enforcement Administration, so we can easily determine what physicians, pharmacies, and other distributors are moving prescription drugs. Some of them are extraordinary outliers. They give us indications of where fraud and abuse is occurring, and we can move quickly on that. That's not been really done before. Target packages are being sent out right now to investigators, and cases are being made. One assistant United States attorney said, I didn't think too much about it, but when I looked at what happened, we knew there were 6 professionals, mostly physicians, in Pittsburgh, and every one of those were on this list. And so it made me a believer, and a lot more were on the list that he didn't know about. We sent out 12 special experienced assistant United States attorneys to hotspots around the country to focus on that. We've indicted 2 Chinese nationals for the first time on fentanyl charges. Most of that is coming from China, as you know, often through Mexico, sometimes directly through the mail to our communities. We established a new program called J-Code. That is the FBI's program with the EA to identify through the dark net and actually purchase undercover drugs in that way and to target those groups. And we announced the Prescription Intervention and Litigation Task Force that will utilize our civil department to file civil lawsuits. We believe we can get an injunction to stop a physician or a pharmacy immediately from prescribing drugs because they have to comply with the law, and we can get a civil injunction and then continue, if need be, a criminal investigation. I'm excited about that, and we've also filed litigation in support of, I believe it will be filed today. We've announced our intention to file a statement of interest with the multi-district litigation effort by a lot of the attorneys general around the country on that. Thank you. I think that, okay, good. So I'll just end there to say, this is what we're doing in our department. You see it in the people you saw earlier in the first panel. I believe if we do these things effectively, we can reduce the amount of deaths, addiction, and destruction that these drugs are causing today. It's just unacceptable in this great country, and we'll do our part. And Kellyanne, I know, I have to say, Kellyanne's leadership is going to be so important in this because we do want prevention. We do need to educate people. The president has used the phrase, just don't start. If you don't start like he never started, and you don't get addicted. So we need to be cautious about, encourage people not to do that. And Kellyanne knows how to communicate well, and it will be a great asset to us. So Kellyanne, thank you.
Thank you very much, Mr. Attorney General. Thank you, Attorney General. I was there on Tuesday when you had the press conference with the state attorneys general and the acting director of the DEA and others, and was really struck by the bipartisan approach that the attorneys general have toward your prescription, that's right, intervention and litigation announcement. Going on to Secretary Kirstjen Nielsen at the Department of Homeland Security, so many aspects of the interdiction of law enforcement front in waging this, the battle against this crisis. Secretary Nielsen falls under DHS, so we're most curious to hear the progress report and also the vision for the future. Thank you.
I did it. I think I was going to have to pass it to you. Well, good afternoon, everyone. I really appreciate the opportunity to join you today. This truly is a shared fight. I'm sure you've heard before and will continue to hear for the rest of today how we must do this in partnership. I'm particularly honored to be joined by leadership from the Department of Homeland Security. We've got ICE and CBP here, Kevin McAleen and Tom Homan. They do this work every day, day in and day out, to protect our borders from all threats and our interior from all threats, but that increasingly, unfortunately, includes opioids. So the president, when he declared an opioid crisis as a public health emergency, he really sent a very strong statement. And the statement to us is America is fighting back. And we will continue to do that with all the tools that we have at our disposal at the Department of Homeland Security in conjunction with our partners, the Department of Justice and the Department of State, amongst many others. Since October, we at DHS have very proactively assessed the current threat, determined where we might have gaps and what else we can throw at it, if you will. So this has allowed us to leverage our investigative and intelligence efforts. You may or may not know, DHS is a law enforcement agency. We have 60,000 on CBP alone, but we have multiple agents throughout the department that play a role in this. So we're leveraging our investigative and intelligence efforts. We also do interdiction operations with our international partners, and we've had great success on that front, particularly with our friends and close partners in Mexico. And we continue to look for new partners because, as we know, this dreaded drug, fentanyl, continues, as the Attorney General mentioned, to come in packages of all sorts and sizes and then get in the hands of TCOs that otherwise use it in the drug flow. So we look at this sort of two ways. We look at within our borders, and then we look at stopping across our borders, if you will. So to prevent entry, we do work with DOJ and state and our law enforcement counterparts in Mexico, South and Central America, and China as well, to prevent the flow, but also, most importantly, to share the information. The sharing of information really has two main purposes. One is to hopefully stop the drugs before they come into our country. But the others is to help us as partners dismantle the TCOs themselves that are the force behind the epidemic. So this information sharing helps us to stop the flow, facilitates the dismantlement, and it also provides clear roles and responsibilities amongst all partners to bring all that we have to bear. So I just wanted to use one example. We have Border Enforcement Security Task Forces, which luckily enough has one of those good acronyms, BESTs. Some of our acronyms at DHS are not so well done. And these are CBP and ICE's primary platform to investigate opioid smuggling domestically. So ICE has BESTs in 58 locations throughout the United States, leverages more than 1,000 federal, state, local law enforcement officials, and it represents over 100 law enforcement agencies. CBP also has officers at hundreds of ports of entry, as you know, and they not only check billions of dollars of cargo each day and millions of passengers a day, but they are particularly focused recently on fentanyl. CBP seizures of fentanyl has significantly increased over the last 3 years. We had about only 2 pounds in 2013. We had 1,485 pounds in 2017. And remember, this drug in extraordinarily small quantities is lethal. So 1,485 pounds is substantial. That is an epidemic. So to confront this explosion, they've expanded the use of canines, and we're happy to report that all CBP canines working in the international mail and express consignment environment now have the ability to detect drugs and fentanyl in particular. While we don't see yet a significant amount of the opioids being trafficked by sea, the U.S. Coast Guard maritime interdictions of other narcotics are increasing, and of course that deprives the funds from the TCOs, who are then able to otherwise use the funds to traffic in the opioids and fentanyl. So to prevent the sale, I'll just talk about that for a minute. We're also committed to not only preventing them at their source, but then of course preventing their movement into and sale within our country. The Attorney General mentioned the dark web. We support his efforts. Our United States Secret Service has extensive cyber capability on the investigation side, and they also contribute to this fight. And so does ICE Homeland Security Investigations. Again, DHS has a broad mission set, but we do in all times work to bring everything we have to bear. The dark net, I would just add one comment to what the Attorney General said. It's anonymous, so it makes it that much more difficult to track who is doing what on the dark net in terms of buying and selling. But with our partners at Justice and FBI and within DHS, we are doing just that. So the job doesn't end there. We also work to support the apprehension and prosecution. Again, we work closely with our law enforcement brethren. What I would say in closing is the sheer magnitude of this means that we have to partner. As I've said many times today, actually in other forum, there's not one entity that has all of the authorities, capabilities, and capacities to fight this alone. So we greatly appreciate everyone in this room, your interest, your support, your partnership. We can't do it without you. We thank the President and the Vice President for their continued leadership, and certainly Kellyanne for all the yeoman work that you've been doing to bring us all together.
Thank you very much, Secretary Nielsen. Thank you. It's been really terrific to have the State Department involved in this effort as well. And today I'm very happy to present to you for his remarks the Deputy Secretary of State, Mr. Sullivan.
Thank you, Kellyanne. It's an honor to be here. Delighted to see everyone here. Thank you for your leadership, and to General Sessions and Secretary Nielsen. You might wonder why the State Department is here. Well, this is a whole of government effort. The President has made this a top priority for his administration. The State Department's involved because the problem we confront is not merely a domestic problem. The opioids that are killing American citizens today are produced overseas and are trafficked by criminals and criminal organizations that operate transnationally. The State Department's role is to stop transnational criminal organizations, so-called TCOs, and the networks of criminal activity they perpetuate in trafficking drugs and destroying the lives of our loved ones. Addressing the opioid crisis, as I say, is a whole of government effort, and the State Department's role is to apply its resources abroad with our partners, allies, and others to support all the work that the Department of Justice, the Department of Homeland Security, and the other cabinet departments are doing to address this problem and this enormous scourge that we have, in to enlist the support of our allies and partners and neighbors in Mexico in particular. It's our highest, at the State Department, this is our highest drug control priority. The bulk of the State Department's counter-narcotics work is focused on countries where opioids originate. Opium harvested in Mexico is the root of over 90% of the U.S. supply of heroin. The TCOs that smuggle it across our border to be sold by dealers throughout the country are the targets that DHS and the Department of Justice are working to stop. We're strengthening cooperation with Mexico through the Merida Initiative to interdict illegal transports, find and punish criminals involved in these organizations, and cut off their sources of funding. In December of last year, Secretary Tillerson and I, along with General Sessions and Secretary Nielsen, continued the strategic dialogue we have with Mexico on disrupting transnational criminal organizations. We're working with our Mexican counterparts to find new ways to disrupt the revenue streams of TCOs that are responsible for trafficking heroin and other illicit drugs into the United States. We're also working with Mexico to more aggressively eradicate poppy crops, train law enforcement, enhance border security, and bring drug traffickers to justice. Over 100 of Mexico's most wanted high-value targets, like Chapo Guzman, have been arrested, killed, or extradited to the United States. And we support Mexico's efforts to find, investigate, and destroy clandestine drug labs. Since 2014, the Department of State has funded DEA training of over 300 Mexican counterparts in special tactics to go after those labs. Since 2008, the United States has donated and supported training of more than 500 canines who are assigned to Mexican and federal and state law enforcement agencies. We sponsor training for canines and handling teams to detect weapons, cash, and drugs. This includes, for the very first time, fentanyl-specific detection training through cooperation with our neighbor to the north, Canada. Last fall, the UN Commission on Narcotic Drugs put new international controls on the 2 primary ingredients that are used to produce fentanyl. This action was taken at the request of the United States, and such measures are already producing results. Due to this change and other efforts, DEA has seen a decline in the presence of these chemicals in the illicit drug market. And in 2 weeks, again at our request, the UN Commission will address controls on 5 other synthetic opioids, including the deadly opioid carfentanil. The State Department is also building partnerships to more effectively stop the traffic of synthetic drugs sent through international mail and courier systems, which General Sessions mentioned. These efforts allow for law enforcement to more easily interdict any packages that may contain illicit fentanyl. China is a growing area of focus on the fight against opioids. Energized by President Trump's visit to China last November, the United States and China have forged a productive counter-narcotics relationship. As a result of our cooperation, China has established domestic restrictions on the production and sale of 143 substances, including a number of fentanyl-related compounds. China's tightening of regulations has significantly contributed to the reduction of these substances on the streets of the United States. Unfortunately, we're beginning to see a new trend of rogue Chinese chemists who are manufacturing illicit opioids, selling them online to drug traffickers and users, and shipping them in small quantities through the mail. As Secretary Nielsen mentioned, the amount of fentanyl that's necessary to convey a lethal dose is extremely small. So we're talking about small quantities of these illicit substances. In response, we're working closely with China to improve coordination and screening of mail packages between our 2 countries. We're on an aggressive timetable to get all packages coming from China tagged with advanced electronic data, and we're going to continue that close cooperation with China and other countries that are sources of these chemicals and illicit opioids. Collaboration is the only way we can tackle a problem that has no regard for international borders. The State Department will continue to aggressively pursue this fight against opioids in partnerships with all other nations. Thank you.
Thank you so much, Deputy Secretary Sullivan. That's a lot of information. I think it strikes America as brand new information in many ways. So we very much appreciate all the efforts of the State Department by Secretary Tillerson, you and your vast team. So we're going to open it up for questions. First will be from New York City, Dr. Jeanette Neshwa. Hi.
Good afternoon, everyone. It's great to be here today to discuss such a critical issue of facing our country. Again, my name is Jeanette Neshwa, and I'm a family and emergency medicine doctor. And I've witnessed firsthand with my patients how devastating and how horrific it is, not just for a drug, for the user, but for their families as well. It can really have a detrimental impact on families and tear families apart. And I will never forget resuscitating a young teenage boy who was found unconscious by his friends. And the worst part, one of the worst parts about that experience is having to tell his family, having to tell his mom. It was heart-wrenching. And I hope and I pray that I will never have to do that again. And so I thank you, Kellyanne, all of you, and our President Trump for elevating this issue, this critical issue. It's a real issue affecting families and many Americans here in this country. And, you know, what I would like to know is what message, what advice does our president have for healthcare providers who are on the front line facing this crisis?
Any of you are welcome to answer that. I know there's a real nexus between law enforcement now and healthcare providers. We hear that from law enforcement. In some jurisdictions, a fire station is 3 to 4 times more likely to respond to an overdose than a fire. So we know there's a nexus, if you'd like to respond.
Yes, there's no doubt about it. One of the ways for many decades we've analyzed how serious the drug problem is emergency room admissions. And I don't think we've ever seen anything like the admissions we're seeing now, and so many of those turn out to be fatal. So I do think that connection is important. I would say to you that most of us know somebody who's also suffered in that way, has been hospitalized or homeless even, and lost their jobs, lost their families. And the grassroots communication of the danger of these drugs is the long-term solution, the best solution we can have. I really do believe that. I think it worked previously against the cocaine epidemic, and I believe it will work now and be the most successful thing. And when you can speak out like you're talking about to your community about the disaster of young lives being lost, that would be important. We were in New Hampshire not too many months ago with the governor, 9,000 high school students. 50 mothers stood before them holding large photographs of their children who had died of a drug overdose. It was a powerful thing to see, and I hope we'll all be touched by it.
Just to add, we always ask for your partnership because it's through the information you provide that we can really get after the supply chain. So we need to at all times understand where it's going, where it's come from, and who it's affecting. That helps us really target, if you will, our enforcement activities. So we thank you for everything you do.
I will say that Secretary Tillerson once shared with me and a few others that he believes patients should be told more that they don't need to take all the pain medication, that part of the prescribing is pain management need not mean pain medication. I know you heard that from Secretaries Azar and Carson and especially Secretary Shulkin earlier, but it just tells you how much everyone is thinking of how intertwined the issue is for many. So we appreciate very much that question. Our next question comes from Princeton, West Virginia, and Greg Puckett. You're here, Greg. Last week, the USDA issued some guidance on opioids in rural America, and I think your question has something to do with that as well.
It certainly does. Thank you so much. I want to thank the administration, the panel, Kellyanne, and everybody else for allowing us to come and be with you today. So I do have a couple of prepared remarks to preclude my question. My name is Greg Puckett. I am a commissioner in Mercer County, West Virginia. I've been a commissioner for 3 years, but I've been active in primary prevention strategies and through local community-based coalitions for the last 17 years. So I know prevention actually works on the front end. I would also like to say that I want to give you a quick snapshot of what it's like to live in rural America. When we started this back in 1998 with OxyContin, when it first came down, it was designated hillbilly heroin for Appalachia. We saw it, we saw this coming, but it also has harm that is not only to the individual, but to society as a whole. In the last 19 years, the social service system that we have seen has become overloaded. Employment rates have risen to record levels. And I can tell you that from 2005 to 2012, the amount of opioids that came to my community was over 16 million in a county of 61,000. West Virginia has declared a state of emergency for hepatitis C, and 7 counties, including mine, are at risk of an HIV outbreak the likes we've never seen. That's 220 counties out of 3,060 in the United States. According to the CDC, 78 people die of overdoses every day. And in West Virginia, we have that 1 out of every 10 hours. If you're looking at from an incarceration perspective, in Mercer County, our jail bill is $1.7 million. That's 20% of our annual budget. We spend more in 1 month of our jail bill than we spend on economic development and our health department combined for 1 month. We need funds in rural communities that look at primary prevention and treatment strategies that have a true impact and not necessarily focus on higher population levels as around the United States, which does lead to my question. With the ongoing exponential problems associated with opioids in predominantly rural America, where geographic terrain and economic disadvantaged areas are, like Appalachia, Is the administration willing to send additional resources to fix these areas first, where they are the greatest?
Well, we are, and I appreciate your comments because it's extraordinary how much impacted our rural areas are. And you see it maybe no place in America worse than West Virginia. We have the DEA is reorganized. It's Rob Patterson here on the front row, DEA acting administrator. And they've reorganized so that they've got a new section, a team that will be focused on Kentucky, Tennessee, and West Virginia, where we've got some of the highest problems there ever. DEA also has 6 special teams they've deployed, and I believe 4 of those 6 will go to rural areas. We have designated in every United States Attorney's Office a specialist on opioid cases, and they're supposed to coordinate our efforts. And I know they'll be identifying the rural areas or some of the worst hotspots. So it's remarkable to me how this addiction, these opioids, have impacted our rural areas, and some of the information and data that you just shared from West Virginia is shocking indeed. The new data analytics situation and numbers, I think, would have identified some of the problems you've had in West Virginia many years before it ever reached the epidemic level that it did.
Just to add, we recognize that this doesn't know any specific geographic boundaries. So at the Department of Homeland Security, we utilize our National Targeting Center to really try to find out where the risk is and then put the resources there. It also bring us back to the mail. The mail makes all areas equal, right? Unfortunately, we all receive mail. So working with the United States Post Office, working with DEA, with DOJ, CBP is really working to get after that part of the flow.
Thank you. Kevin Mira from Hamilton, New Jersey, where we're talking about maps and identifying spikes in need. Sir.
Thank you very much. Happy St. Patrick's Month to everybody here today. And I want to thank the President, First Lady, and everyone over at ONDCP who's never said no to the parents. My name is Kevin Mira, and my wife Marianne and I volunteer for a small mom and pop nonprofit in New Jersey. All volunteers, and we don't have any federal grants or state grants. So my question is, one second, I forgot. Kellyanne, my wife said that the only way I could retire is if I work with you on the opioid epidemic. So since you're both Jersey girls, I figured maybe you could work it out with her. But
got it.
Thank you very much. So I'm not a professional. I'm just a dad who buried his son. Casey was 24 when we lost him. I can't believe, it's just hard to fathom that my journey has taken us from his bedroom, where we lost him, to the East Room of the White House. But actually, with all due respect, I'd trade it, all of this, just for 5 more minutes with him, just 5. So City of Angels, although it's a small mom and pop nonprofit, we think we do some big things on the leading edge of the curve. And what I mean by that is we started sending volunteers in the hospitals and into the emergency rooms and into the police departments back in 2008. Now they call them recovery coaches and hope and angel programs, so on, so to speak. But my question centers around ODMAP, another leading edge thing. And we found this down at the Baltimore, D.C. HIDA. It's actually an app for your phone where the first responders, police officers, and emergency medical technicians responding to an overdose can actually sign on and send information, and the overdoses would be tracked real time, which would also go to help identify spikes. And so we're hoping that if there's a possibility that this could be done as a national model and introduced as such. And I'm just going to close by saying I look at your chair, your empty chair there, Kelly, 5,394. 5,394 from today, March 1st to April 1st, Easter Sunday. That's how many chairs will be empty at Easter tables, because we're losing 174 people to overdoses every day. And I'll just close by saying thank you very much, secretaries. You want to know me for what I've learned over the last 10 years. You don't want to be me for what Eric and these other parents have gone through. Thank you.
Thank you so much. Thank you so much, Kevin, for sharing your story and making a difference for others. Also, we will keep you in our prayers. I know, Mr. Attorney General, you talked about data sharing and analytics, and of course, Mr. Mayor is talking about the use and the ability to have better data sharing by tracking overdoses and identifying spikes. Anything in the data analytics that you want to talk about?
Yes, the HIDA program, I think, started in early 2017, last year. A lot of places are looking at that around the country. I know a number, I think 3 or more counties were in their initial project. It's proving apparently successful in being adopted. I would just say every area of the country, when you deal with this, we all know there's not one single thing that's going to fix it, but a series of actions, even if it reduces the problem 1, 2, 3, 5%, helps us to be more effective, will add up over time to begin to reverse this trend. And we also know, and was told at New Hampshire when I was there for the first time, but I've heard it repeatedly, that you would think when a powerful fentanyl supply starts killing people, that people would flee from it. But the DEA tells us that some people come, particularly the addicts, and they want more of the more powerful drug. So this kind of early identification can help deal with a spike in extremely dangerous levels of fentanyl.
Thank you very much. Another father who's been able to take that resolve and that action forward, and we saw him on tape earlier, is my old friend Eric Bowling, along with his wife Adrian, has a story to tell about their son Eric Chase. But Eric, I think today you have a question for this particular panel about interdiction that you'd like to pose.
First of all, I would like to say thank you to President Trump, the First Lady, Kellyanne Conway, all the secretaries, the deputy secretary, and the generals, General Sessions and General Adams. Thank you guys so much. Law enforcement, we needed to thank them a little bit more. They're on the front line. They've been amazing, and that's a tough job. I got to tell you, some of the things that they see, you wouldn't wish on anyone. And finally, thank the parents who came here. This is, we didn't sign up for this. I certainly didn't sign up for it. None of us signed up for this, and it's been very, very difficult. A quick story. My question was on the fentanyl, the illegal Chinese fentanyl, and I think you guys have hit it, and it sounds like you're on top of it, and I think it was very important. My son died of an accidental overdose when he bought a pill on campus. He was a college sophomore. He bought a Xanax. He thought it was a Xanax, and it happened to be not a prescriptive Xanax, but one that was purchased from someone on campus, and the Xanax was laced with fentanyl, and he died in his sleep that night. What I'd like to just mention here, he passed on September 8th of this past year. September 9th, we flew out to Colorado, and we're sitting with our doctor. We're about to go over to the coroner, and it's just something no parent should ever want to do. My phone rang, and it was President Trump. And he said, Eric, I don't know how you're doing it. I just want you to know you're in my thoughts and in my prayers, okay? A few weeks later was Thanksgiving, first holiday after his passing, and we're about to sit down, a small group of people, 6 or so of our family members, and there's that empty chair. And I know it's about to happen. We're going to sit down, we're going to see the chair, we're going to fall apart. As literally the turkey is on the table, we're walking over to the table, the phone rings again, and it's President Trump saying, Eric, This is very difficult. It's your first holiday without your son. I don't know how you're doing it. If you need anything, let me know. And I said, Kellyanne, I said, Mr. President, thank you. You're going to help this whole family, but can I talk to you about this crisis that's killing so many of our young people? He said, absolutely. And that's how I started talking to him and Kellyanne and others about, in the administration, about the opioid crisis. I got involved, but I'm getting involved as a father. I'm not getting involved as, I have no issue, I have no website, I have nothing other than I don't want anyone else to feel the depths of despair that you feel when you lose a child. I'm representing you guys, the families who are here who've lost loved ones. That's all it's about. It's you, it's not me. General Sessions, thank you for being strong on enforcement. We appreciate that. Secretary Nielsen, thank you. I hope we get that southern border up, the wall up, so that we can stop some of this stuff that's coming through the southern and northern borders. And also, Mr. Sullivan, thank you very much for what you're doing. I think China is, you just need to lean on them as hard as you possibly can. My question was answered, but thank you guys all so much.
I just want to, first of all, please accept my condolences for everyone in this room who has lost someone. We all need to work together to prevent other families from feeling that pain, but that doesn't in any way, I know, limit the pain that you feel. So thank you for sharing with us, each and every one of you. I did want to pick up on just one thing you said, which is when it comes to border security, it's not, and it should not be, as I said earlier today, a political football. It's real. The threat is real. The drugs coming across our border are real. The traffickers and the TCOs coming across and utilizing loopholes in our border are real. So I hope that we can also all work together on bipartisan legislation that will give the men and women of DHS the tools they need to secure our borders. That will help not only with this threat, but many others. But truly, we owe it to each other to give it a good shot at trying to stop the drugs from getting into our country. So thank you for raising that.
Yeah, and I'd just add on China, we work very closely with the Chinese government. They have listed, proscribed, as I mentioned in my remarks, 143 chemicals which are now banned under Chinese law, so their law enforcement now can go to work. We're working to identify other chemicals and analogs of the opiates that also need to be addressed. But there are three aspects of it. One is identifying the substances that need to be controlled and declare illegal. Then, once that happens, working with law enforcement in other countries, in Mexico, for example, so that their law enforcement, with support from us, the Department of State and the Department of Justice, can go after the drug labs, go after the transnational criminal organizations. And then finally, one thing that may be overlooked, and I mentioned it on my remarks, and I think both General Sessions and Secretary Nielsen mentioned it, is the use of the mail. We've really got to focus on that because the amount of substance that is dangerous that can be sent by mail is really very small. We've got to work on tracking, detection, and so forth, working with international postal authorities, the Universal Postal Union. So a lot of areas for us to work on at the State Department, and it's a priority for us, as Kellyanne said, for Secretary Tillerson and of course for the President. So thank you.
Thank you very much, Mr. Deputy Secretary. All the way from Anchorage, Alaska, Jay Butler. Yes, sir. Good afternoon.
Thank you. I have the privilege of being the Chief Medical Officer for the great state of Alaska, so I'm here to tell you that no part of our country is too remote. No part of our country is immune from the threat of this epidemic. I also have the privilege of being the incident commander for Governor Walker's Unified Command Response, where we've brought together 9 departments of state government to work together in this response. And I want to thank the President and thank all of you for being together today. I see at least 6 departments of the federal government together here today, maybe more. I also want to thank you for the support that we receive from the federal government, particularly in terms of funding, because working together and with adequate funding, we can make a difference. And the good news is we're already seeing some progress. In Alaska, we are seeing declines in overdose deaths related to prescription opioids. The bad news is that progress is literally being obliterated by the influx of fentanyl, with huge increases in the number of deaths related to fentanyl, even in some of our most remote villages. So fentanyl is powerful, it's cheap, as the general was saying earlier, and it's easily transported. We feel like much of the transport within the 50 states, and certainly within our state, is related to transport on commercial air carriers. So my question is, how can we improve screening for illicit drugs, fentanyl, and I also should mention methamphetamine, which we're seeing more of also, on commercial air carriers, particularly in checked baggage, carry-on, and in shipped packages? And even more particularly, how can we help assure that law enforcement and drug dogs have access into areas controlled by the commercial carriers? Thank you.
Thank you, and thank you for that question. You know, today we are celebrating 15 years of the creation of the Department of Homeland Security, which is both a happy day and a sad day. Sad because we have to have a Department of Homeland Security. But we talked a lot this morning about our expanding mission space, and certainly part of it is with respect to drugs. So as you know, traditionally in aviation, we think of bombs, we think of unruly, criminal-minded passengers, but drugs more and more are top of mind. So TSA plays a role domestically with checked baggage, but CBP is actually our premier component within DHS that looks at the foreign travel of passengers, identifying not only high-risk passengers, but those parcels and checked baggage that might contain drugs. Dogs, as you mentioned, are a very important asset. We love our dogs. They do incredible work. They put themselves in danger each day. As we know, unprotected, if a dog sniffs a very small amount of fentanyl, it will die. So we use the dogs, we use them with caution, we protect our officers, but the targeting becomes very important, and that's where I echo the Attorney General and Secretary Sullivan's comments, because it's only through that information sharing that we can really target. Otherwise, we couldn't possibly go through everyone's piece of luggage, for example. So we do it in a risk-based way. The last thing I would just mention is technology. We continue to look at technology both at our ports of entry as well as our airports to ensure that we can get down to a level where we can identify and interdict even small amounts of drugs. So thank you for that. That's definitely something we need to continue to work on.
Thank you very much, Mr. Butler, and thanks for being here from Alaska. Attorney General Sessions, we heard a comment earlier from Princeton, West Virginia that you touched upon, but I'm wondering if you wouldn't mind telling us a little bit about anything the Department of Justice may be able to do to crack down on the pill mills and the fraudulent prescriptions, knowing that there are tens of millions of Americans who suffer from chronic pain and need those medications. We're talking about the pill mills and the fraudulent prescriptions, like the amount of pills we heard from West Virginia.
Yes, it definitely has to be looked at. We are, as a nation, an outlier. We consume extraordinarily more pain medications by prescription than any other country in the world by far. That is resulting in addiction. A substantial percentage of addicts started with pain pills. And Drug Enforcement Administration, I'm sending him a directive or request today to look at their regulatory capabilities that we can perhaps reduce the number of drugs being prescribed in America. It is my goal, two goals about prescription drugs in particular. We want the death rate down, and we'd like to see the amount of drugs prescribed down. If we are an outlier and we way above the right limit, and we have Medicare, Medicaid, VA, and private insurance paying for these drugs to make people sick, it makes no sense whatsoever, actually killing people. So we've got to tighten that up. I think we are above the right level now, and we're taking a number of steps. DEA can pull a license for somebody they identify as a improper prescriber or a drugstore that's improperly selling, even before a criminal case is made. So we think we need to get better about shutting them down, and we can't wait a year for a criminal case to be made and they continue to prescribe drugs. We can do that through civil lawsuits, and we also, as I indicated, looking to civilly join with our states in some of the litigation that they're filing, and we're looking to see if there's additional civil litigation that the Department of Justice can take independently of the state lawsuits.
Thank you very much, Mr. Attorney General. Deputy Secretary of State, Mr. Sullivan, Secretary of Homeland Security, Ms. Nielsen, and our Attorney General, Jeff Sessions, please join me in thanking them for this panel. Thank you. Thank you very much. So we've had two panels. The first one was about treatment and prevention and recovery, education, and now this panel on law enforcement interdiction. This is a president who's committed to all three fronts: education and prevention, interdiction and law enforcement, of course, treatment and recovery. Every great movement to bend the curve in the right direction has wonderful people who are marshaling their efforts on the ground, has a terrific administration of cabinet members and sub-cabinet members and senior staff. And I want to say again, with great distinction and great gratitude from each and every one of us, the biggest stars of the show today are those families and those who are affected who have the courage to come here. And we pray for you, and we thank you very much for coming forward and helping us on this crisis next door. But every great movement has a leader, and our leader is the President of the United States, and it gives me great honor and pleasure to introduce him to you now, the President of the United States, Donald J. Trump.
Well, thank you very much, Kellyanne, and it's an honor to be with you. I just said I was going to stop over, say hello to some of the great families and some friends that have had some incredible difficulty. I know what you're going through. Melania's here someplace. Where is our First Lady? Where is she? Where's Melania? Hello, darling. So she feels so strongly about it. Kellyanne feels so strongly about it. And I do. And a friend of mine, Steve Witkoff, who's a great developer in New York City. Stand up, Steve. I didn't know you were going to be here. Steve had some big difficulty he went through. Steve, come on up here. Steve has been one of my great friends over the years, tremendously successful man. And would you want to just discuss this? Because we're all among friends here. You know, it's a tough thing to discuss, right? But I was there when he was going through something with a very special boy, right? Go ahead, Steve.
I remember the hug you gave me when I felt all was lost. I listened to Eric's story. I lost my son in 2011, and he didn't buy drugs on the dark net. He bought drugs on the internet. A website owned by 3 of the largest U.S. corporations in the country today. So it's not just the dark net, but he was a great kid, and he detoxed the first night with me. So he was my special child. So if I lost him, I always felt like hopeless before you were elected. And I've never lobbied my friend about anything. I've just supported you because I so believe in you. But if my son knew that you were going to take up this battle, oh my gosh, he must be upstairs applauding every single day. So I am so grateful. Thank you.
Thank you, Steve. You take it away. Thank you. And Steve went through something where he thought everything was perfect. He thought everything was fine. and his boy was recovered. And then all of a sudden, out of nowhere, he got some very bad news. So I fully understand what you're going through. The administration's going to be rolling out policy over the next 3 weeks, and it'll be very, very strong. I've also spoken with Jeff about bringing a lawsuit against some of these opioid companies. I mean, what they're doing and the way the distribution, and you have people that go to the hospital with a broken arm and they come out and they're addicted. They're addicted to painkillers and they don't even know what happened. They go in for something minor and they come out and they're in serious shape. So we're going to very much, as you know, I think we've been involved more than any administration by far. It's a problem that's growing, and drugs are a similar but different problem in the sense that we have pushers and we have drug dealers that they kill hundreds and hundreds of people, and most of them don't even go to jail. If you shoot one person, they give you life, they give you the death penalty. These people can kill 2,000, 3,000 people, and nothing happens to them. And we need strength with respect to the pushers and to the drug dealers. And if we don't do that, you're never going to solve the problem. If you want to be weak and you want to talk about just blue ribbon committees, that's not the answer. The answer is you have to have strength and you have to have toughness. The drug dealers, the drug pushers they're really doing damage. They're really doing damage. Some countries have a very, very tough penalty, the ultimate penalty. And by the way, they have much less of a drug problem than we do. So we're going to have to be very strong on penalties. Hopefully we can do some litigation against the opioid companies. I think it's very important because a lot of states are doing it. But I keep saying if the states are doing it, why isn't the federal government doing it? So that'll happen. In the meantime, I just want to pay my respects to everybody. Some of you have gone through a lot. Many of you in this room have gone through a lot, more than anyone can imagine. We're with you 100%. We're fighting for you, and we're going to win. We're going to win. Thank you very much. Thank you, everybody. Thank you.